What you see on the screen is an illustrated sheet that highlights the close anatomical relationship that exists between the heart, the lungs, and the arterial and venous vessels. This sheet belongs to the third book of the anatomy treatise Humani Corporis Fabrica Libri Septem, published by Andreas Vesalius in 1543. The complete work consists of 7 books and more than 700 illustrated pages, and is considered one of the most influential in the history of medicine. In this way, Vesalius dismantled some of the most serious anatomical errors of the Galenic school, such as the idea that large blood vessels were born from the liver. However, he supported others, such as the concept that arterial blood circulation was distinct and independent from venous. As you can see, painting was the only cardiac imaging technique available in ancient times, and despite how much the world has changed since then, modern cardiologists continue to paint hearts. Hello, welcome to Cardio Flash College, a place to learn cardiology with flash animations. As you know, in this channel we try to represent the complex and fascinating world of cardiology with drawings, with the aim of facilitating the academic training process. So these are 5 images. Pulmonary embolism. Number 1. As you know, pulmonary thromboembolism, or PE, occurs when there is a partial or complete obstruction of blood flow through a pulmonary artery as a consequence of a systemic embolic phenomenon. Generally, it is a thrombus from the venous system, but on some occasions it can be fat, air, or neoplastic tissue. As you know, some of the most frequent symptoms of this entity are dyspnea, chest pain, cough, and hemoptysis, among others. For these reasons, chest X-ray is usually one of the first imaging tests to be performed, as it constitutes a fundamental tool in the study of dyspnea of cardiac or respiratory origin. However, this test may be of little use in the case of pulmonary embolism, since the most characteristic radiological alterations of PE are usually rare, and in most cases the chest X-ray shows non-specific alterations or has a normal appearance. But what are the most characteristic radiological signs of pulmonary thromboembolism? Well, let's take a look. First, we have the Westermarck sign. This is a radiological finding that is characterized by an isolated radiolucent area in the middle of the pulmonary vascular network and reflects the absence of blood flow due to local arterial thrombosis. Then we have the Pala sign. This sign indicates the amputation of one of the branches of the pulmonary vascular network. And finally, there is the Hampton sign, which appears as a peripheral radiopaque shadow of hilar vertex and pleural base, corresponding to the area of pulmonary infarction. Number 2. Pulmonary CT angiography, computed tomography pulmonary angiography, or CTPA imaging protocol, is a diagnostic test frequently used in patients with suspected PE. Its high sensitivity and specificity make it a first-choice clinical tool in patients with a high clinical probability of pulmonary thromboembolism, or in patients with an intermediate or low probability who present an elevated D-dimer. This diagnostic resource is available in the vast majority of health centers, so that the study can be carried out on a preferential or emergent basis in most cases. As you know, the CTPA imaging protocol builds a digital volumetric image of the pulmonary vascular bed from simpler images obtained through axial sections of the thorax. Everything is done after administering an intravenous bolus of contrast, synchronizing its injection with the acquisition process of the equipment, so that we can achieve the maximum possible enhancement of the pulmonary arteries. Thus, to obtain optimal image quality, the patient must remain still and hold their breath for at least 30 seconds. However, image quality can sometimes be affected by other reasons, such as the patient's body volume, the presence of metal prostheses, and low cardiac output. Finally, we consider that a test is positive when we find filling defects in the pulmonary vascular bed. On the other hand, the absence of these defects will lead to think that the test is negative, as long as the image quality is appropriate. Otherwise, it could be considered that the test result is not conclusive, and for these reasons, it would be necessary to resort to other diagnostic tools. Number 3. Ventilation perfusion scan is an imaging test that is frequently recommended in those patients in whom the CTPA imaging protocol cannot be performed, or in those cases where the test result is not conclusive. This test is generally recommended in patients with a normal chest X-ray, as scans performed in patients with abnormal chest X-ray are more likely to result in a false positive. Some of the limitations of this test are, for example, a long acquisition time and a high probability of obtaining intermediate examinations, which, in general, are insufficient to confirm or rule out pulmonary thromboembolism. Finally, and as you can imagine, this test should not be performed on pregnant women. Number 4. Echocardiography is a non-ionizing imaging test that may be useful in patients with suspected PE and a contraindication for radiological studies, or in those patients who are so hemodynamically unstable that they require an emergent diagnosis. The definite diagnosis of pulmonary thromboembolism can be made when the existence of thrombus within the pulmonary arteries is demonstrated, but this is rare. So it is usual to make a suspected diagnosis when the existence of thrombus within the right chambers of the heart is confirmed, or these chambers are shown to be acutely dilated. However, in addition to right chamber volume and pressure overload, there are other characteristic echocardiographic findings. For example, systolic dysfunction of the right ventricle, tricuspid regurgitation, abnormal septum movement, and the McConnell's sign. Thus, the McConnell's sign consists of an alteration in the radial contractility of the right ventricle, which affects the lateral aspect of the right ventricle but respects the apex. And although it is not very sensitive, it is very specific for pulmonary thromboembolism. Number 5. As you know, pulmonary angiography was for a long time the gold standard technique for the diagnosis of PE. However, with the development of the scanner, it has been losing prominence in clinical practice and is currently reserved for those patients in whom the result of the CT scan or ventilation perfusion scan are not conclusive, or simply for those patients in whom percutaneous intervention may be necessary. In this way, we can summarize the procedure as follows. After attaining a central venous access, a pigtail catheter is mobilized on a J-wire through the superior or inferior vena cava. After reaching the right atrium, the tricuspid valve, the right ventricle, and the pulmonary valve must be crossed. Finally, contrast is injected with a perfusion pump through the catheter, and different angiographic projections are used to evaluate the right and left pulmonary vascular bed. After confirming the diagnosis, this catheter can be used to administer local fibrinolytic treatment, or even, if necessary, to perform percutaneous thrombectomy using specific fragmentation and suction devices. But we will talk about this and other therapeutic strategies another day, as it is material for another video. In this way, we say goodbye. It has been all for today at Cardio Flash College. We hope you liked the video. If so, subscribe to the channel and leave a like. We'll see you in the next class. And remember, don't come late. Bye!